Almost a year back, I was working on my doctoral thesis and struggling, of course, with the rigorous concepts of data science. One morning, I had a meeting with my doctoral advisor and a group of doctors in a hospital. In this meeting, the doctors showed me a database with lots of health data. It was almost 11 years back in my high school. I said goodbye to biology and was living happily in the field of computer science. So this data appeared to me nothing but a set of medical jargon. I brought home the database and was struggling on it for almost a week. The objective was to use artificial intelligence to make some better sense of this data, to find some correlations, some patterns or something. In this haze of physiological parameters, health data, complicated stuffs, when I was almost about to give up, a column caught my attention. It was written, death. Man is mortal, it's so obvious. But still, the word death never goes very easy. So in this column of death, there were several ones and zeros, where one stood for people or patients who are dead. I suddenly realized that I'm looking at a database of patients where some patients are already dead and others are going through a treatment. It may sound very trivial, but this one thing suddenly stirred me so much that the always difficult field of artificial intelligence turned out to be my best friend. Before working on this, I was working in the field of Internet of Things, or IoT, or I would rather say Internet of Everything. It's basically a set of technologies, fascinating technologies, which connects multiple devices, sensors, even people, to collect data, share information among each other, to proffer smart services, intelligent services. When I was traveling to different places to give lectures on IoT and healthcare, this e-health, always I received this one question from the audience: what is the price? And when I said that, I heard a murmuring, wow, that's quite expensive. Even I received questions like, do we have this technology right here for everyone, all the hospitals, for all of us? Well, the questions are quite obvious, but it raises a very crucial point, the divide. Technology is advancing at a super fast rate. We have smart cars, smartphones, smart devices, and whatnot. But with that, another thing is also increasing, the gap. The disparity of technology increases as well, which is often linked to the economic divide. But technology, by its virtue, should be inclusive. It should be for all. The technology that contributes to the betterment of living, the basic requirements of life, should be inclusive. It should be for all. The benefits of this technology shouldn't be inaccessible to marginalized people. Let's consider technology as this smart tech in healthcare. It's available today. We have this smart healthcare or this smart technology in healthcare, but at a very dearly price. Many a times I asked myself this question: why is quality healthcare this costly? Looking from a holistic view in a broad scenario, the key factor that separates this smart, tech-rich healthcare from one group of people to another is the cost. Years back, working in the field of IoT and e-health, I always believed that the crux lies in these beautiful smart devices, sensors, smartwatches, etc. I was wrong. After seeing the database in the hospital with lots of patient health data, I realized that the superpower lies in the data itself, which has the power to change everything. Working in AI in e-health, I had a thought: how this artificial intelligence or AI can change the healthcare scenario as a whole. Thinking about the advancements of technology we have today, it's not so difficult to imagine how a futuristic hospital looks like. But I try to ask myself, how the futuristic pharmacy shop will look like? How the futuristic humble village health center will look like? When I was a kid, back in India, if I had some fever or some flu, my parents would take me to the local doctor's chamber down the street. I try to ask myself, how AI can change this small local doctor's chamber down the street? And here comes the fundamental point, the democratization of healthcare, the democratization of quality healthcare, so that the benefits of this smart technology we're talking about is uniformly distributed, the advancements, the benefits are available to all. The ultra-tech healthcare we are talking should be inclusive. It shouldn't be restricted to the barriers of affordability. And here lies a crucial role of AI. Artificial intelligence is basically the theory and development of computational systems which can do some things real smart, real fast, and real powerful. When applying to healthcare, this AI has a quite wide range of applications, starting from image processing, from intelligent diagnosis, from personalized treatment, and many more. But no matter how wide the domain of application of AI in healthcare is, the crux or the core lies basically in the driving forces, which are the data and the algorithm. This part, the driving forces, are not essentially or wholly related to the costly tech or the costly devices, which we usually think when we talk about smart healthcare. The health data we have today is the highest of all times. It's just enormous. Artificial intelligence uses its algorithms to analyze this data and looks for interesting patterns, correlations, interesting insights, which often the traditional methods won't find. So basically, it helps in quite a wide domain of application when we talk about AI in healthcare, like early prediction of diseases, prediction of risks, some efficient treatment paradigms. And this whole part is not essentially related to the smart tech we usually understand. Moreover, the most important part, the insights we obtain using this AI, mostly on the health data, are quite scalable. Imagine a futuristic hospital which receives maybe some hundreds of patients. Now, using AI, we can analyze detailed the health data of all these patients, and maybe we can design a better treatment strategy, a better treatment plan. This treatment strategy can serve to people who maybe not having means to even come to this hospital. For example, to predict a certain disease, maybe we need 8 to 10 classical health parameters. But if we consider artificial intelligence, it has the power to analyze maybe hundreds and thousands of parameters. And with this, the traditional model maybe have never considered these parameters. So AI has the power maybe to suggest a new treatment plan or maybe new predictors of diseases. And here lies the fundamental insights of a better treatment plan, of a better treatment paradigm, the diagnosis, the personalized medication. This whole part lies here itself. This entire aspect we are discussing, this personalized diagnosis, efficient treatment, is applicable to a global community as well. Of course, AI in healthcare throws fundamental challenges, like the ethical aspect of collecting data, sharing data, the aspect of data privacy and security. But for example, if I tell you that right now, your brain surgery will be done by a robot on its own, completely, maybe we'll feel like, well, wow, maybe we'll be a bit afraid. But if I tell you that, well, your house physician who looks after you will analyze all your medical history in her computer, use an AI algorithm, and provide you a personalized treatment strategy, maybe we'll like it. It will be a welcome move in this direction. So the key point is clear. The quality tech-rich smart healthcare we talk about is basically confined today to a limited group of people who can afford. But AI has the power to change the entire domain of this healthcare to democratize the aspects of intelligent treatment, intelligent diagnosis, personalized treatment, etc. Moreover, the health data, the insights which we obtain from this health data are scalable. We can obtain the health data from people from another continent. Using AI, we can analyze and look for some better correlations or better insights, which we can apply to people here in this city, or maybe to people in a remote village. And here lies the key role of AI, to democratize the benefits of technology in healthcare, to generate transferable knowledge, transferable insights, which you can scale to people, to marginalized people, to people in other parts of the world as well. As researchers, we shouldn't forget the responsibility of completing the feedback loop of AI in healthcare. For example, the data, the health data of patients shouldn't just stay in the computers as sample data or training data. The benefits, the insights should be sent back to the patients in the treatment itself to complete the loop. In this way, we can design better diagnosis, better treatment paradigms. And in this way, we can ensure that in the future, most of the people won't think that, okay, smart tech healthcare, AI in healthcare, it's costly, it's not for me. It won't happen anymore. The tech-rich smart healthcare we think about should be inclusive, will be inclusive for all. With this, I invite all of you to embrace this fascinating technology of AI in healthcare, not just because it has the power, the potential to completely democratize the benefits of this technology in healthcare, but also it can practically reshape or re-engineer the entire treatment paradigm which today we have traditionally in the field of healthcare. And also to fulfill my personal mission to change the ones in the database we saw in the beginning with dead patients, to change these ones to zeros. Thank you very much.
Thank you.